JIC inspires people to take a global approach to general practice.
It provides a forum for discussion, it provides a network with like-minded doctors, it provides support for doctors who are quite keen and are proactive to undertake activities that may be slightly out of their comfort zone.
JIC has a number of different working groups that specialise and look at certain areas, but we also overall try to increase uptake and inspire a global approach to primary healthcare.
About 3 years ago we managed to get a grant from the EU which helped us fund 30 UK GPs to do exchanges across Europe, and those 30 GPs also hosted our European colleagues.
From the point of view of the Vasco da Gama movement, there's a similar set of organisations like the JIC across Europe, and we work together to try and reach common goals and objectives.
I'm involved in looking at the GP curriculum to see how global health can be incorporated.
Beyond Europe Group is one of the 5 subcommittees on the Junior International Committee. We've got a number of projects running at the moment.
We've recently had an exchange to Japan where 5 of our members went off to Japan to see how primary care was working there. You may have heard about our partnership with Médecins Sans Frontières. We've also got a partnership with the Bwindi Community Hospital in Uganda, and we're looking to develop further international partnerships.
An out-of-programme experience is when you're training in general practice and you take time away from your training to do a project overseas.
I was lucky enough to have my out-of-programme built into a pilot scheme, so my GP training involved part of my training. Instead of doing a 6-month UK hospital post, I went to a rural hospital in South Africa, and that counted for my training.
I undertook this between ST2 and ST3 of my GP training. I did a split year doing part research and part placements in Italy.
There's a wealth of resources within the JIC, not just in terms of personal experience, but in terms of the contacts that people have from their exchanges that have taken place in the past.
We have quite a good network in terms of the different deaneries that support out-of-programme, so we could easily put you in touch with the relevant deanery that runs an out-of-programme experience.
Part of our role is to advocate and to say, give you sort of firm evidence and support for how you can persuade your deanery to actually do it, because it really is worthwhile.
I really enjoyed it. I found it incredibly enlightening. I learned a huge amount from it, both at the time and in ways that I was then able to bring back to my practice here in the UK.
It was amazing. I can't sum it up in a few moments, but it was life-changing.
Enlightening.
Enthusiastic.
Inspirational.
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 I'm going to use the same word as everyone else.
It was probably inspirational.
Dynamic.
Amazing.
I had a different one in mind, but I can't remember it now.
Collaboration.
Inspiring.
Awesome.
Inspirational.